I'm Brigadier retired Dr. R.K. Sharma. I have been practicing in fertility for more than 20 years. Earlier in Army Hospital Delhi and FMC Pune, and for last 3 years now I am at Primus Hospital. I have been looking after this infertility patients, both male and female, and been instrumental in designing and executing the first IVF program in a government setup at Army Hospital. And I have seen more than 10,000 IVF babies coming out of my hands. Many patients have a lot of worries and questions about infertility and its management. First of all, it is what is IUI? IUI is a procedure where the husband's semen sample is prepared and is put into the uterus of a woman. For this procedure to be successful, the woman should have at least one fallopian tube which is patent. She should have enough number of eggs or oocyte, what we call it, and the husband should have adequate number of sperms. This can be done both for the female factors like PCOD, early endometriosis, unexplained infertility, and also for the males who have little less number of sperms, around 10 million per ml of the semen sample, and also those who are having some ejaculation problems. For this procedure to be successful, we give few tablets and injections to the woman so that she forms about 2 to 3 eggs in that cycle, and the cycle is monitored by ultrasonography. Once the follicles have reached a size of 18 to 20 millimeter, we give some injections so that they rupture easily, and after 36 hours of giving the injection, husband gives a semen sample which is prepared and put into the uterine cavity. Another question which is there is what is the success rate of IUI? Under the best of circumstances, the success rate is around 20 to 25% when we have given all the best protocols which are available. So that means it is not 100%. A patient who does not conceive in the first cycle has to undergo the same procedure next cycle. Depending upon the age of the woman, we allow not more than 4 to 6 cycles of IUI in lifetime of woman. In case she doesn't conceive with IUI, she should proceed to IVF. IUI can have its own problems also during the procedure. Though the aim is that she should form not more than 3 to 4 eggs in that particular cycle of stimulation, but some patients, especially the PCOS, they may form many eggs. So we have two choices, either to cancel the cycle or shift it into the IVF program, which is more beneficial to the patient, and such patients can benefit by switching over from IUI to IVF protocol. Another complication which can occur after IUI is the multiple pregnancy. Most of the time it is a twin pregnancy, but sometimes it can be triplet also. In that situation, one may have to reduce one of the weaker embryos so that the patient can have twin gestation to go on. Another complication which is very rare can occur is an infection if the procedure is not done properly, but under the circumstances in which we are practicing in all the modern hospitals, the incidence is almost zero. And the cost of IUI is a cheaper treatment protocol, and in a cycle, approximately including the medicines, it will cost around 20,000 rupees. I hope the information which I have given to you is concise and to your satisfaction. In case you have some more queries, you can contact me in the description box which is given below.